Is your baby too big for you to be able to give birth vaginally? I can't tell you how many pregnant mamas have told me that their doctors are telling them their baby's too big, so they have to be induced before it gets even bigger, or even do a C-section. We here at the Mighty Mom Movement are not big fans of inducing or doing C-sections for a baby that's too big, unless there are certain not too common circumstances that can affect that. So today we're going to talk about what to do if you're being told that your baby is too big and how to navigate the situation and see how to handle that. I'm Rachel Moises, a mother of 8.
And I'm Heather. I am a family nurse practitioner and midwife.
So let's talk about why are mamas being told their baby's too big and what should they do when that happens to decide if it's really true and what they need to do.
Okay. So a lot of times they're told baby is too big because they've gotten a late term ultrasound, 38 weeks, that kind of thing. And the ultrasound tech has said, oh, this baby is 8 pounds, 9 pounds, 10 pounds, whatever. And the problem with that is ultrasounds are off by 2 to 3 pounds. Very, very common for them to be off. And that happens a fair amount, but it is a great excuse to either induce or just schedule a C-section and get that baby out.
Now, is it true that ultrasounds become less accurate as the pregnancy
goes? The further along in the pregnancy, the less accurate they are at estimating the weight and the date of delivery.
Mm-hmm.
Yeah. So you have to be very, very careful. That's why we never move someone's due date that got an ultrasound, let's say at 36 weeks, when they also had an ultrasound at 20 weeks or at 12 weeks.
Mm-hmm.
That the earliest ultrasound you get is the most accurate for dating. And then as far as weight, yeah, it really is. It's a guessing game is what it really is.
Okay, Mom, a quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dilating to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learned these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you'll be so glad you did. So to begin with, your baby might not actually be as big as they're saying it is. It could be,
right?
But because they're so inaccurate, it's interesting choice to be making medical decisions, important medical decisions,
right?
Increasing risks for some things based on something that we know has a low accuracy.
Well, right? And here's the thing, I have almost never, it's so rare that an ultrasound will say smaller than baby actually was. Like they'll say, oh, this baby is 6 pounds and it actually was 7 pounds. It's almost always saying baby is bigger than baby actually is.
Mm-hmm. Yep. Yeah. And this was my experience with my first baby. They were telling me that she was too big and we had to induce because she was so big. And then she was born and still a relatively large baby, but not nearly as big as they said. And I was like, my baby wasn't that big.
Right.
As you guys were telling me, it really happens a lot. Okay, so what's the problem with inducing just because the baby's big? Like, why not just go for it?
Right. So you may have a baby that would have done a gestation to 41, 42 weeks. You're inducing at 38 weeks. That's a baby that's 3 or 4 weeks early. Now, according to 40 weeks, it's only 1 or 2 weeks early, but according to how long the baby would have gone, that's a 3 or 4 week early baby. And that can cause, you're going to have a higher rate of NICU admission because baby may have, like their lungs just may not be as developed as they should have been. So it's just important to, for the most part, let the body deliver when the body wants to deliver.
It's because an induction is an intervention. Okay.
Right.
So we talk about this a lot in the Mighty Mom movement. Induction is necessary sometimes. It can even be life-saving sometimes. It's really important that we have the ability to induce labors. But for doctors just seem to like to induce so much when it's not necessary. And from the perspective of mom giving birth, an induction is usually more painful. It's going to be a longer, more drawn out labor. And I'm speaking from the perspective of someone who's been induced 7 out of 8 times. And that's a whole long story about why, if I needed to be induced or not with each one of them.
And the type of inductions you had were different.
Well, but my first 3 were medical inductions where my doctor convinced me that they were medically necessary, but I was ignorant. I didn't know how to determine if I really needed to be induced or not, and I just went with it. Where now, with the knowledge I have looking back, I know that I didn't really need to be induced in those, and I could have had better birth experiences.
Right.
Yeah, later on, my inductions were natural inductions with Heather. Some of them were medically necessary, and actually, after I tried a natural induction, I liked it so much that I was totally fine with just doing it.
Well, and just real quick, it's not the point of the video, but a natural induction only works if the body is ready.
Yeah.
If the body's not ready, you'll have some contractions and we're like, sorry, the breast pumping is not working.
Yeah. And I still didn't do natural inductions early on, or anyway, you don't even know my whole life story about inductions. But the point is that generally speaking, you only want to do an induction that is medically necessary. Right. And having a big baby is not usually a real reason for medically necessary induction. So let's talk about how common is it for a baby to actually be too big?
So, there's the saying that you will only grow a baby as big as you can deliver. And for a healthy woman, a healthy pregnancy, that is typically the case. So the exceptions to the rule are a mom who had gestational diabetes or type 1 diabetes, any type of diabetes. You have a very good chance of growing a baby that is bigger than your body would have normally grown a baby to birth. If you, let's say early on, you had been in a car accident, like in your high school, and you had broken your pelvis may not move the way that a normal pelvis would move in labor. And so you don't want a big baby because of those restrictions. So you have to look at what are the reasons that could, I guess you could say, artificially or unnaturally cause a large baby. Mm-hmm. And those can make it so that you don't want a larger baby.
What about a really petite, short woman?
I have had women that were 5'2", 120 pounds when they got pregnant that have delivered 10-pound babies just fine. Mm-hmm. And just a couple of stories real quick to give you some examples, if that's okay. I love stories if you haven't figured out. I had a woman who had 2 C-sections. Her first baby was 10 pounds, pushed for hours in the hospital. And they said, no, you don't have a good enough pelvis. It's called cephalopelvic disproportion, CPD. And they gave her a C-section. The next baby, they induced her. We won't even go into that, how that is crazy to induce a VBAC mom with Pitocin. They induced her and she ended up in a C-section. So she came to me because she's like, I really don't want a C-section. And I was like, okay, like my philosophy is you're not proving to me that you can have a baby. You're proving to me that you can't have a baby, because my assumption is every woman can have a baby. Prove to me you can't. Mm-hmm. So went through her whole pregnancy. Her labor was great. She pushed her baby out in 20 minutes. So much better than the first baby that pushed for hours and hours and hours in the hospital. And her baby was 11 pounds.
Wow.
Just a pound bigger than that first C-section.
That they told her she wasn't capable of
Exactly.
birthing.
Exactly. And she did it in 20 minutes of pushing. Absolutely unbelievable. I mean, just phenomenal. I had another mom who she'd had a few children. So, that's always nice because the pelvis kind of, it knows what it's doing that way. And after about 10 minutes of pushing, she's like, why is this taking so long? And we were like, it's been 10 minutes, and she had pretty average size babies. Mm-hmm. Well, she also pushed for around 20, 30 minutes. no complications. When we weighed her baby, I have pictures of her baby. It was 11 pounds, 15 ounces. That baby was 1 ounce away from 12 pounds.
Wow.
And she had no problems. Now, one of the things they say, oh, we need to do a C-section, which is really, really common, or we need to induce you, is because they're like, oh, you could have a shoulder dystocia, which is when the head comes out, but the shoulders are stuck on the mom's pelvis. And you know what? I've had people with shoulder dystocias that had 6-pound babies.
Right.
You know, and I've had both of those women that I told you about, neither of them had a shoulder dystocia, not even close. I would say the vast majority of my shoulder dystocia babies are 7 pounds, 7 to 8 pounds. You know?
So being bigger baby doesn't increase the risk.
I mean, statistically it does, but I haven't seen, and I've done 1,000 births, and I haven't seen it really make a huge difference at all.
And I've delivered 2 babies with shoulder dystocia, and it's not my favorite thing to deal with, but if your provider knows how to handle it well, it's also not the end of the world.
Exactly. And that's the thing, is that there's no guarantee. So you're taking a C-section and all the risks that come with C-section, or all the risks that come with a forced medical induction, over the woulda, coulda, shouldas.
Yeah.
The what ifs.
Right. And what we talk about a lot is weighing the risks versus the benefits.
Exactly.
And so I guess you're saying the risks of C-section, in your opinion, usually outweigh the risks of trying to deliver a baby that might maybe be bigger than you would want.
Exactly. Now, I have had one mom out of all of these, that one of the babies she delivered with me was, probably, I'm going to guess low 7s, if I remember correctly. And that mom was the only mom that I've ever come to and said, your next baby, we need to have earlier, because she barely got that baby out at 7 pounds. And it was just something about her pelvis that this mom needed 6-pound babies. And so her next baby, it was one of those times at induction, we did a natural induction, meaning we didn't use Pitocin, we didn't force it, we worked with her body. And she still had a hard time, but not as a harder time at that 7 pounds. So it can happen with anything. The shape of your pelvis, there are some women that are just more prone to shoulder dystocia. Do we know that beforehand? No. Sometimes you just have to have a mom with a shoulder dystocia, and it could be a fluke. She may never have another shoulder dystocia again, or she could be the mom that a lot of her kids, she has a shoulder dystocia, and we just have to make sure. I had another mom, she's had 3 shoulder dystocias with me, not big babies. And because once again, it doesn't have to be a big baby. And with her 4th, she'd moved to another state. And I said, you find a midwife who is extremely comfortable with shoulder dystocias, because you have them. And it was not even related to a big baby.
So, okay.
Yeah.
So what does a mom do if her doctor or midwife says, we're inducing, or we're going straight for C-section because your baby is too big? We just did an ultrasound. It's too big.
Right.
Does she have to just accept it? Can she say, I don't want to? What does she do?
I would ask why they're afraid of it. Are they not comfortable with shoulder dystocias? Are they afraid of
big baby? Is that why?
Is that the main reason
why?
Ask them why. So then it's shoulder dystocia.
Okay.
But ask them, okay, why are you concerned? And find out why. 9 times out of 10, they're going to say shoulder dystocia. Or they will say, you won't be able to push your baby out. Well, what do you mean I can't push my baby out? Get their definition. So find out what their concern is first. And then the next thing is find out if there's a holiday coming up or they're going on vacation.
Is there any ulterior motive here?
Right. If you've had a baby before, I would look at that. Well, hey, I pushed out my other 8.5-pound baby just fine. So why would there be a problem now? And then look at your health history. Do you have type 1, type 2 gestational diabetes? Do you have issues? Did you gain a lot of weight in pregnancy, like, 60 pounds, that they are concerned that they could have undiagnosed diabetes or something? Is there a health reason there? Or is it just, and I would get another ultrasound. You might have to pay out of pocket for it. And, but usually insurances allow 4 to 5 ultrasounds per pregnancy. I would get another ultrasound. I would demand another ultrasound, because if baby rotates their position a little bit, you can get different measurements.
Okay.
So, yeah.
So first thing is try to get your doctor to explain to you, okay, you're telling me it's a big baby. That's not enough reason for me. I want more reasons than that. And if they're like, well, you've had gestational diabetes, and so there's reason to believe that your baby
it could be
is
possible.
bigger than, if they say that. But if they say, well, we just think it might get stuck, then you're like, well, but also might not.
Right.
And a C-section has a lot of risks. I don't know, how hard are you going to have to push if you're just thinking, you're not giving me a good enough reason, and I don't want a C-section or early induction, because if they do this at 37 weeks, then they're like, let's just get baby out before it gets any bigger, right?
Right.
But if you're kind of further along, they're going to say it's too late. Like, we're doing a C-section. Is that kind of generally how it works?
Yeah. And, and it depends on the provider.
Yeah.
So sometimes you can change providers. We've had people that change to us all the time. So that depends where you're at, what your insurance is, what your financial abilities are. You have a whole bunch of in that play. But I would definitely get a second opinion, even if it's just from another ultrasound, same doctor kind of thing. And tell the doctor, I thought ultrasounds could be off by 2 or 3 pounds. They won't refute you. They'll go, oh, yeah, well, yeah, dang it, she's educated. You know what I mean? So I would call them on their bluff, that way. Hey, ultrasounds can be off by 2 or 3 pounds. So that means my baby could be 6 pounds when you're saying 8 pounds, or 7 pounds and you're saying 9 pounds. So look at that. And then if you need to, hopefully you're in a position that you can change providers. You can get another provider that will help you.
So do you think that most often a doctor will say, nope, it's C-section for you, and I'm not giving in on this?
I think it depends on the part of the country that you're in. If you're in an area with a high C-section rate, they'll just go straight for a C-section. It's just easier. They get a little bit more money with a C-section. They don't have to wake up in the middle of the night. They can just get in, get it done, and get on with their day.
Yeah. Okay.
So
if you're firm on, I absolutely do not want a C-section because I'm not convinced that it's medically necessary, you might have to switch providers at the last minute, which no one wants to deal with.
Right.
But it does happen, and you can't do it.
The other thing you can do is, now this takes a lot of bravery, I guess you could say, on your part, but you just don't, you push it, you don't show up for the C-section or the induction or whatever it is. And when you go in, you're going to have to deal with the wrath of your doctor, because they will have a wrath. And if they discharge you from care or you go into spontaneous labor, you can choose what we call doc of the day. There's always in all the OBs that have privileges at the hospital, they have to rotate being on call for people that don't have a doctor assigned to them. Maybe they were traveling or came from a home birth or something. They just didn't have an assigned doctor. And you can fire your doctor in labor and say, give me doc of the day. And they have to give you doc of the day. And so, I mean, what's it going to hurt? You're already up against a wall. The wall can't get any firmer.
So it is an option to just not show up for that C-section. No one's forcing you to. They're not going to drag you to the hospital, and then you wait until you go into labor. And
when I was a doula, I had a mom who refused an induction for this reason, and the doctor called her up and yelled at her. And I just remember thinking, who are you to yell at this woman? Now, I would be fine if he called her up and said, these are my concerns, and this is why I'm worried. But they should never be yelling at you or giving you ultimatums or things like that. That's just not good.
Yeah, that's not a fun situation to be in. Nobody wants to have to disregard their doctor's advice, and we're not telling you to do that. But some women will make that choice on their own.
Right, but you do have that right.
Yeah, it's important to realize it's still your body, it's still your baby, and they can't actually force you to do an induction. But of course, if you are considering making that choice, you need to really understand the reasons that your doctor is wanting to do the C-section and the induction, and feel really confident that there's not an actual medical reason for doing it, right? We're not telling you just ignore whatever your doctor says because he's or she is definitely wrong.
Right, exactly.
But it happens. And we see that a lot in the Mighty Mama movement, because I don't know, maybe it's just because they're more educated, but it does come up a lot in posts from mamas who are saying, I don't know how to handle this. And a lot of other moms are saying, well, just don't go, just don't do it. Right. But it can feel kind of scary. Like you said, it takes a bit of bravery and feel overwhelming. And then the other option, like she said, though, Heather is still a practicing midwife, and you have women who come to you at the last minute and say, I'm done with my doctor. Will you take me?
Yep.
And you do, usually, if you can, right?
Exactly. Like, I remember a mom who was forced with the option of a C-section, and she came to us, did what we call a meet and greet. She came in and we answered her questions and stuff, met her, and the next day her husband called and he said, my wife's in labor, what do we do? And I said, well, she needs to decide if she wants a vaginal birth or a C-section first, And so he goes, oh yeah, okay, I'll call you back, So he called me back about 15 minutes later and he's like, she wants a vaginal birth. And I said, well, then let's do it. Like, you've got a lot of paperwork to sign, because I knew she'd had prenatal care. I knew that she'd had that, and I was willing to take her on. Not all providers will do that. Some providers say you have to have at least 2 prenatals with me, or you're going to get different across the board.
But you can call around and see. And of course, you determined that in this case the C-section was not medically necessary, and that you felt that it was safe to proceed forward with a vaginal birth, whereas her doctor obviously didn't agree or didn't want to deal with it.
And she did. She had a beautiful vaginal birth, so it was great.
Okay. Yeah. Well, we hope that gave you some insights on big babies and what to do if you're told that you have a big baby. And if you haven't done so, you can also check out our free birth class, How to Give Birth with Practically No Pain, where we talk about some great strategies that can help you have an easier birth, and that can really help birthing a big baby be easier when you know how to handle birth well. So there's a link to that. You can check that out too.